So we'll start with liver failure. Acute liver failure in children is a devastating multi-organ syndrome characterized by sudden and severe liver cell dysfunction in a previously healthy child. Multi-organ failure includes hepatic encephalopathy, coagulopathy, sepsis, hemodynamic disturbances, acute respiratory distress syndrome, etc. ALF previously healthy child liver disease symptoms start and gets acute liver failure within 1 to 4 weeks of the symptoms. This is called acute liver failure. Subacute if the symptoms between patient goes into failure from the onset of liver disease between 4 weeks to 6 months, and chronic liver failure means if the patient is having disease and goes into failure after 6 months. Infections, causes of liver failure in infants are infections like viral infections, herpes, hepatitis B, Epstein-Barr, parvovirus, measles, enterovirus, cytomegalovirus, Coxsackie B, etc. Metabolic causes include galactosemia, tyrosinemia, GST, MPS, Wilson's. Other metabolic disorders also lead to liver failure. Cardiovascular myocarditis may lead to liver failure. Drugs and toxins like paracetamol overdose. Causes in children, infections again tops the list, which includes leptospirosis also. Metabolic and viral hepatitis uh, is the leading cause. Metabolic again, Wilson's in Indian child cirrhosis, storage disorders are the causes. Drugs include paracetamol, anti-epileptic, anti-tubercular, vitamin A toxicity. They may cause acute liver failure. Veno-occlusive disease, Budd-Chiari syndrome, congestive cardiac failure, autoimmune hepatitis, and idiopathic. Sometimes we may not get the cause. Clinical features of acute liver failure include general features, that is fever, arthralgia, myalgia, malaise, nausea, loss of appetite, jaundice, ascites, edema, etc. Clinical features of hepatic failure especially are encephalopathy, which gives headache, confusion, irritability, delirium, disturbed sleep pattern, motor incoordination, hypertonia, seizures, coma, etc. Signs of coagulopathy like hematemesis, melena, petechiae, etc., renal failure, electrolyte imbalance, sepsis, cardiovascular system gives history, see features of congestive cardiac failure or myocarditis. So these are all the complications occurring in acute liver failure, all the symptoms occurring in acute liver failure. Signs and symptoms of chronic liver failure include mental changes, alopecia, fetor hepaticus, jaundice, poor muscle coordination. KF rings are classical for Wilson's disease, puffiness of face or edema, gynecomastia, spider nevi, palmar erythema, flaps and tremors, capute medusae over the abdomen, ascites and hepatomegaly, petechiae or ecchymotic patches, pedal edema, and testicular atrophy. Pathogenesis for chronic liver failure, hepatocyte injury or Kupffer cell injury or endothelial injury. If there is a hepatocyte injury, then all the signs and symptoms of decreased liver functions, which I have already discussed first. Kupffer cell injury, then there will be decreased clearance of the toxins, drugs, metabolites, etc. Endothelial cell injury, there will be decreased perfusion clearance and coagulopathy. Staging of encephalopathy, stage 1, dullness, disturbed sleep. Stage 2, drowsiness, confusion, disorientation, mood swings. Stage 3, very sleepy, arousable, not arousable, unresponsive to verbal commands, and there will be hyperreflexia. Stage 5, patient is unconscious, decerebrate posturing, decorticate posturing, and delta waves on EEG can be seen. Now, what are the investigations to be done in a case of liver failure? The general investigation is a complete blood count, malarial parasite to rule out malaria, Vidal test, CRP, blood culture, urine culture, electrolytes, random blood sugar, and ABG. Liver function test, we have to do bilirubin, SGPT, OT, ammonia, alkaline phosphatase, coagulation profile should be done. Kidney function test should be done. Test for the cause of liver disease, serum copper and ceruloplasmin estimation, antibodies, that is hepatitis markers for hepatitis A, B, C, D, E, autoantibodies, torch tests, galactosemia test for galactosemia, color Doppler and ultrasound, X-ray chest, slit lamp examination for KF ring. Now, the general management in a case of liver failure, we have to maintain the temperature, give antiemetics, IV fluids to maintain the hydration and electrolytes and sugar levels, raise head end to 30 degrees, catheterize the patient, maintain hydration, electrolytes, antibiotics to avoid superadded infection. Specific treatment for complications, we have to give vitamin K, lactulose, IV mannitol if the patient is going in coma, high bowel wash, injection ranitidine, add potassium to the drip, and acetylcysteine for overdoses. And blood products when as and when required, octreotide if there is bleeding, hemodialysis if there is a renal failure, and the ultimate answer for any chronic liver failure cause is liver transplant. Thank you.